A patient stopped her osteoporosis medication after talking to her friend, after getting advice from a friend, and a year later, she had 4 spinal vertebral fracture. One osteoporosis drug should never be stopped suddenly, and I'm going to discuss why. Stopping Prolia without a plan can lead to multiple spine fractures within months. No, I understand that many people fear osteoporosis medication, but stopping them incorrectly can be far more dangerous. And a simple conversation with your doctor could have prevented 4 fractures. Hello, everybody. I'm Dr. PK. Today, I'm going to share you a very important clinical lesson about osteoporosis treatment. I recently saw a new patient to me, 76-year-old female, hunched back with a spinal pain, seeing me for the first time. And her story highlights a serious medical issue that many people don't know about. She had osteoporosis and had been taking Prolia injection, a common medication used to strengthen bones. But about a year ago, a friend warned her about possible side effects. So she stopped the medicine on her own without informing her doctor. What happened next? About a year later, she developed severe back pain, and she had a progressive spinal curvature, kyphosis, difficulty standing upright. An imaging study revealed something concerning for thoracic vertebral compression fracture. This is something we unfortunately see when Prolia just stopped abruptly. Why this happens? Now, Prolia denosumab works by blocking a signal protein called RANKL, RANKL, which reduces bone breakdown. So while you are on the medication, bone loss slows down, bone density improves, fracture risk decreases. But unlike some other osteoporosis medication, Prolia does not stay in the bone long term. So when it is stopped, bone turnover suddenly increases, bone density drops quickly, and then vertebral fractures can occur. This is also known as rebound bone loss. Okay? And in some cases, patient can develop multiple spinal vertebral fractures within months. The most important rule about Prolia, the key rule is simple. Prolia should never be stopped without a transition plan. If it must be stopped, doctor should prescribe other medications such as reclast or oral bisphosphonate like Fosamax alendronate to protect the bones from high turnover during transition. And without this step, fracture risk can rise dramatically. So what we do for patients like this, in patients who develop fracture after stopping Prolia, treatment is only involved restarting osteoporosis therapy quickly, sometimes restarting Prolia itself. In severe cases, bone building medication like Evenity or teriparatide. The goal is to stabilize the skeleton, prevent additional fracture, and rebuild bone strength, right? Patients should take adequate calcium, vitamin D, supplementation, and fall prevention strategy, physical therapy for posture and strength. And at age 76, and this patient, preventing further fracture is extremely important. So I want you to remember this simply, that never stop an osteoporosis medication without speaking to your doctor first. Sometimes the medication itself is not the problem. The way it is stopped is what causes harm. So if you or someone you love is taking Prolia, always discuss a safe transition plan with your healthcare provider. Thank you for watching.